I'm Josh Mugel. I work for Northeast Georgia Health System, and this is Emergency Medicine.
So we are standing right now in the Gainesville Emergency Department. It's one of our 4 emergency departments here in the Northeast Georgia Health System. It's the largest one. We see over 100,000 patients a year here. We are a level 2 trauma center by the state of Georgia. We also are a designated cardiac arrest center. We see all types of patients here. We see adults, peds, behavioral health patients, obviously our trauma, stroke patients as well. So we have a huge breadth of pathology that we see at this campus.
So NGHS is a community hospital. So if you're interested in becoming a community hospital, I think this place is an excellent place to train because we have an excellent community hospital experience. You have providers that have been practicing community medicine, but also academics. It's becoming an academic center, but it doesn't have a lot of competition for procedures, and so it's a good place where you're not going to feel that you have to be fighting for procedures. And there's a lot of acuity. We have oftentimes multiple STEMIs, multiple traumas, multiple strokes, all in one shift, and so you'll get exposure to a great variety not only of patient populations, of different styles of teaching, but also of pathology.
We have an extremely well-resourced and efficient department, so we have some awesome nurses who totally will have your back and help you with whatever you need. We have 24-hour CT, 24-hour ultrasound, 24-hour MRI. We have 20% pediatric volume that will be integrated into your emergency department shifts.
A2 ETA, 5 minutes, critical, or A2 ETA, 5 minutes.
We have multiple critical care patients who are going to be extremely helpful for your learning opportunities here at Northeast Georgia Medical Center.
Hi, my name is Andy Ball. I'm one of the emergency medicine physicians at Northeast Georgia Medical Center in Gainesville, and will be serving as one of the core faculty for the emergency medicine residency program. I'm also the medical director for the Hall County Fire Services, where I've been here for 30 years. So on your clinical shifts, you'll come and spend time with these folks and learning the full gamut of pre-hospital care, things from all the equipment that we use to working with protocols, standing orders, experiencing station life, shift work, and seeing how things work in the pre-hospital setting.
All right, so right down here in this hallway, we have part of the emergency department. We have 3 full bays of rooms that we can see patients in. It's not our main area, but we have had some sick patients over here that we have had to intubate, but it's not our main trauma area. We have a little small nursing station here where we can sit at least 1 or 2 nurses, as well as one of our advanced practice providers and a scribe. If we get really busy, hey, we even have a room over here that has its own monitor, a little lounge chair. We can put patients in here as well. This room here is where a lot of bad stuff goes down, meaning we save lives. Remember, we are hardwired for excellence. This is room 14. Come on in. As you see here, very large room. We have big lights for our resuscitation. Over here, we got our code card over here. So your heart stops, we will shock it back into rhythm. Over here, we got a big sink if we need to clean all that blood off of our hands, get ready for procedures. We got medication carts, we just got it all in here. We even have our ventilator in here. A lot of cool airway stuff. So for those of you who like fancy airway gadgets, look at this. We got an intubating bronchoscope.
The department here are normally relatively busy. There's some nights are busier than others, but it's a comfortable pace for you to acquire your training. We do focus on bedside teaching for our students and oncoming residents. And today is a pretty typical day in the ER here.
Okay, everybody, this is our ambulance bay. As you see, we already got a couple of ambulances in this bay that have brought some very sick patients to our department. It's a very large bay. That's sharing the parking lot. We also have our COVID-19 tent where we get a fair amount of low-risk COVID-19 patients that usually will go home, but if they're sick, we can still manage them from the tent and take them right into the hospital. All right, guys, that concludes our tour of Northeast Georgia Medical Center Brazelton. We look forward to you joining our program. If you are somebody who want to think outside the box, that's innovative, that's creative, that want to create their own path our emergency medicine residency program is the place for you. Come join us.